Derivative 22 syndrome, or DER 22, is a rare disorder associated with multiple congenital anomalies, including profound mental retardation, preauricular skin tags or pits, and conotruncal heart defects. It can occur in offspring of carriers of the constitutional chromosomal translocation T11, 22, Q23, Q11, owing to a 3:1 meiotic malsegregation event resulting in partial trisomy of chromosomes 11 and 22. An unbalanced translocation between chromosomes 11 and 22 is described as Emanuel syndrome. It was characterized in 1980. Sign and symptoms. Infants with Emanuel syndrome have weak muscle tone, hypotonia, and fail to gain weight and grow at the expected rate, failure to thrive. Their development is significantly delayed, and most affected individuals have severe to profound intellectual disability. Other features of Emanuel syndrome include an unusually small head, microcephaly, distinctive facial features, and a small lower jaw, micrognathia. Ear abnormalities are common, including small holes in the skin just in front of the ears, preauricular pits or sinuses. About half of all affected infants are born with an opening in the roof of the mouth, cleft palate, or a high arched palate. Males with Emanuel syndrome often have genital abnormalities. Additional signs of this condition can include heart defects and absent or unusually small, hypoplastic, kidneys. These problems can be life-threatening in infancy or childhood. Causes. Emanuel syndrome is an inherited chromosome abnormality. It is caused by the presence of extra genetic material from chromosome 11 and chromosome 22 in each cell. In addition to the usual 46 chromosomes, people with Emanuel syndrome have an extra, supernumerary, chromosome consisting of a piece of chromosome 11 attached to a piece of chromosome 22. The extra chromosome is known as a derivative 22 or DER 22 chromosome. Genetics. People with Emanuel syndrome typically inherit the DER 22 chromosome from an unaffected parent. The parent carries a chromosomal rearrangement between chromosomes 11 and 22 called a balanced translocation. No genetic material is gained or lost in a balanced translocation, so these chromosomal changes usually do not cause any health problems. As this translocation is passed to the next generation, it can become unbalanced. Individuals with Emanuel syndrome inherit an unbalanced translocation between chromosomes 11 and 22 in the form of a DER 22 chromosome. These individuals have two normal copies of chromosome 11, two normal copies of chromosome 22, and extra genetic material from the DER 22 chromosome. As a result of the extra chromosome, people with Emanuel syndrome have 3 copies of some genes in each cell instead of the usual 2 copies. The excess genetic material disrupts the normal course of development, leading to intellectual disability and birth defects. Researchers are working to determine which genes are included on the DER 22 chromosome and what role these genes play in development. Diagnosis. Emanuel syndrome can be diagnosed with a karyotype, with FISH, or with a chromosomal microarray analysis. Treatment. Emanuel syndrome does not have a cure, but individual symptoms may be treated. Assessments of individual systems, such as the cardiovascular, gastrointestinal, orthopedic, and neurological may be necessary to determine the extent of impairment and options for treatment.
Please subscribe and thanks for watching.